joining us in studio. You know what? I mentioned I thought Russell was coming in today, but it's the big boss himself, Dr. Jonathan Tripp.
Or the not so big, I hope. Yeah, been trying to lose weight, so not so big.
Well, your office has a specialty at that. We'll talk about that again someday. But first of all, we want to welcome him back. We call it Better Health with Tripp Family Medicine between 8:30 and 9 o'clock, right here on News Radio 1310 KLIX and newsradio1310.com. My name is Bill Colley, and I'm essentially here just to answer the telephones for the doctor.
All right, sounds good.
This is actually topics today. We're talking about various issues people have with their legs, and much more common too, I guess, than I would have thought when I was younger.
Yeah, well, you get wiser as you get older, don't you?
You also start to pick up those varicose veins as you get older.
Yeah. Yep. Well, today, like going to the gym, today is leg day, so we're going to talk all about some things relating to varicose veins and muscle cramps, restless leg syndrome, and swelling. Those are all kind of hot topics that come through my office on a regular basis. But first, I wanted to just make mention of the baby that died this past week in the hospital, and I don't know any of the details other than what's been shown on the news. But basically, it's a young man, 7-month-old, named August Dean Elliott, and this is a true tragedy. And I, have no intent of trying to place blame on anybody. But since this young man's died as part of a community outreach on our Facebook page, which is Tripp Family Medicine, we are posting a link to their it's a funding site to help them. The name of the funding site is called I just blanked on it. It's GoFundMe, and it's a memorial fund for burial costs and whatnot for this family in relation to this baby's death. So again, I want to just mention this is a true tragedy, but we'd like to have you, if you want to contribute to the family and their needs. It is Tripp Family Medicine. It's our Facebook page, and there'll be a link to that GoFundMe site there. So back to not quite so heavy a subject. Let's talk about leg swelling. Any stories, again, for callers that you want to call and say, hey, I had this experience, and I had these gnarly looking varicose veins, and here's what we did about them. Or, I really found out that I tried compression stockings, and wow, what a difference. Or what'd you do for restless legs? We have some medicines that sometimes are effective, but that's a tough one. We're going to talk about that. Especially everybody that has any age on them will know if they go traveling for long distances or go on an airplane, the legs tend to swell when they might not any other time in your daily routine. So call us with some of those stories if you have that.
I had a grandmother, and I can recall in her later years, and I only really knew her in her later years, but she used to have on her left leg a large brown bandage that would be wrapped around her leg every day from essentially just below her ankle all the way up to her knee. And that was because of a very similar condition she had with swelling in just that one leg. Now, often, I know this from my own experience. I went to the doctor a few years ago because I was waking up and my feet were looking swollen. And that was because I was sitting in a chair hosting a radio show and doing that sort of thing most of the day. And he said, get up and get around a little bit more. And sure enough, that was all I really needed to do, and it suddenly went away. But there's a wide variety of things here, and I'm sure they can tell you a lot about what's going on internally, too.
Yeah, let's stick with the swelling of the legs. Swelling often is, let me describe what goes on in the veins to begin with. You basically have arteries that have a real nice structural wall around them, a muscular wall. Veins are kind of floppy straws, if you will. If you think almost a paper on a straw that you open at a restaurant, that paper is about the integrity of a vein. However, the veins have valves in them because, from especially the legs, you're going against gravity. So how does the blood get pumped up that way? Because it's being pumped down by the heart. The way it gets pumped up mainly is our walking. When we flex our muscles, we get it actually squeezes those veins, pushes blood one direction or the other, and if you have valves that are competent, that hold the blood where they should, it only gets pushed one direction, and that is up. If you have valves that are kind of incompetent, they kind of leak a little bit, the blood will get pushed both directions, and gravity helps fight the whole system. So what we're really looking for is, get up, get moving. It's exactly what you were told. And as we sit in a chair, especially if our feet don't meet the floor nicely, that chair pushes right up in the back of our thigh, right behind the knee, which is where the major veins go. And so you're putting a lot of back pressure on those legs. So getting up, moving around is a big part of this. And the other thing is, if you do get swelling on a regular basis, is use gravity in your favor and get your feet up above your heart by laying down and putting a pillow or two under them, because that blood will now use gravity to get back to your heart, take the swelling out of your legs. So that's an easy answer, but the question is, why do you have this? Do you have incompetent valves in your veins, which is a big possibility? Do you have some other things that are slowing that circulation? Like, do you actually have some hardening of the arteries and making the pressures higher down there? And contributors are things like being overweight. The biggest one that people can relate to is pregnancy. Almost
Hmm.
always in the third trimester, woman will get swelling in her legs. And why is that? Well, because, she got a, 6 or 8 pound baby with, uh, you know, a sack of fluid around it and everything else. That when she stands up, that baby's pushing pressure on the biggest veins coming up from her legs right in the pelvis, and that causes, a lot of back pressure on the legs. So what's the answer for that swelling? Well, a lot of elevation while you're pregnant, and lo and behold, usually delivery of that baby changes all those dynamics and the swelling goes away.
We've got more with Dr. Jonathan Tripp on the way. Joining us from Tripp Family Medicine right here in Twin Falls. And of course, if you have a comment or question for him, he's here until 9 o'clock this morning. Keep in mind that number. Jot this down if you have to: 736-0300. 736-0300. It's Better Health on News Radio 1310 KLIX with Dr. Jonathan Tripp and Bill Colley answering those telephone calls. Our guest is Dr. Jonathan Tripp. He joins us on Wednesday mornings from Tripp Family Medicine right here in Twin Falls, located on Fillmore Street. And take some time out to talk to you about some medical issues, and also if you're inclined to answer a couple of questions on the air. You're listening to News Radio 1310 KLIX and newsradio1310.com. Bill Colley, of course, in the studio as well. You were telling me a little bit off air about recommendations on compression socks.
Yeah, compression stockings. There's a brand name that doctors often have prescribed for years called Job stockings, and the way they're usually thought of is they go all the way up to the thigh, which is appropriate if your swelling is that extensive or your varicose veins are that extensive. But I got talked into wearing compression stockings by my non-medical wife, and I was doing 24-hour shifts at the Air Force Base and standing on cement most of the time, and started to get just a touch of swelling at the end of those shifts. And she says, "You're going to wear these," and went online and bought me a $60 pair of quote sports compression stockings, and they are actually becoming more popular for distance runners. So she did get it from a sports rather than the old person's stocking place. And so I humored her and wore them for a couple of these shifts. And sure enough, I didn't get any swelling, but I didn't notice any difference. And then I skipped it for a few shifts and realized that I had not paid attention to how much my legs ache at the end of those shifts, and they didn't ache when I wore those compression stockings. And knowing the medical background on this and feeling better, I started wearing them every shift. And also when we traveled, especially by air, I would start to get some of that swelling as well. And so I'd wear these same stockings. They go up to the knee. And when I'd get to wherever we were going, not only did I not have swelling, but my legs felt better. And they reduced the risk for deep venous thrombosis or blood clots in your legs from traveling. So, I have a nephew that, traveled to Hawaii. He's going to school there and ended up with blood clots in his legs that showered to his lungs. It's called a pulmonary embolism. And the only thing they can come up with of why he had this is they say, well, it's because you traveled by plane to Hawaii from Portland. And my reaction is, how many people do that all the time and never have a problem? And he's a, 17, 18-year-old, super healthy kid, semi-pro soccer player. So my thought is, why not wear those compression stockings, reduce your risk right there? But so swelling is one of the symptoms. Varicose veins may be a symptom, and the two may go together. If you have poor veins, you tend to get swelling. If you have veins that aren't working real well, sometimes they're really painful. I just had a lady in my office yesterday or day before, and that was her main complaint. She's got a nice big ropey area of veins in the back of her one calf, and she'll wear a compression stocking. I don't know why she wouldn't do both, but she wears it on the one side, and it helps her with the pain, but it's always there, it's always present, and she's not overweight. What are some things that contribute to poor circulation or actually arterial sclerosis? Number one, smoking. I have another lady who was in my office last week. She's had what's called roto-rooter is the best term I can tell you, kind of cleaning out some clogged arteries in her legs because she could walk for about 50 feet before her legs hurt, and then she'd have to wait for a minute or two and walk another 50 feet. So she'd had that operation done on one leg and it had improved, needed it on the other, and she struggled with that. But the bottom line is she's a pack and a half a day smoker and won't quit doing that, and that's the single biggest contributor to all of her vessels being clogged.
I had an
So,
experience. I worked in a postal sorting plant for a while when I was younger, and it had a concrete floor. And after 8, sometimes even 12-hour shifts, the legs would really ache. So I started wearing the gels under my heels, and that seemed to help. But the friend who got me the job had actually retired because he'd worked for the same sorting plant when it was in an older building and had a wooden floor, but he just couldn't take walking on that concrete floor.
absolutely.
And so a lot of people, especially even in hospitals, like medical professionals, are walking around on these tiled floors, but there's nothing beneath that floor that's soft.
Nope.
And that, I think, is a huge problem for a lot of nurses, especially.
Yeah, no, it's a mean environment from a from a leg standpoint. You're up for hours, you're on your feet, and there's no give in that floor. We often talk to runners and say, do you run on the sidewalk on the cement? Do you run on the asphalt? Do you run on the grass? Because if you run on the grass, it's not even. You're at a higher risk for the ankle sprain. But actually, asphalt is more giving than cement, and that's noticeable to some runners, especially as they do distance. But getting back to the varicose veins, what do you do about them? Well, insurance won't pay to have varicose veins taken care of unless they're painful. If they're not painful and you just say, hey, these are ugly and I don't like how they're looking, you can pay to have them done. So whether you're paying or insurance is paying, the two techniques that I know well, the older techniques called vein stripping, where they actually make a little cut in the skin higher up and below, farther down on the vein, and they actually pull that vein right out. And people say, well, where's the blood go after that? And the answer is it never was doing very well through that vein, so it has already found other routes. The other is a technique using a laser that it's like a catheter in your arm, but in the leg, we're going into the vessel. And as that catheter gets drawn out, it actually is cauterizing the inside of that vessel. So it's scarred shut. And that way, you have one incision where the catheter goes in. And that's a pretty nice, effective method. And it is used for cosmetic purposes as well as for what we'd consider a medical varicose vein removal. Those are probably the two most prevalent techniques.
Does that mean that the purplish vein color will go away?
Yes, yeah. The rope disappears because there's no more blood going through there. The color you're seeing is actually the blood. In fact, a lot of people will have small, what are called spider veins. They're more reddish. They can be purple as well, but they're usually the size of a pencil lead or smaller. Those are ones that I actually treat cosmetically with a technique called sclerotherapy. They are not known to be big contributors to leg pain or to swelling. They are truly a cosmetic treatment, which is part of my background. So if you have those and want to get rid of those, happy to talk to you about that as well.
You have a mention in the outline for today about restless leg syndrome and cramps, and I have occasionally woken in the middle of the night. I mean, I wake up and because I'll suddenly have a cramp in one of my legs. It seems to often be related to just diet. If I eat more citrus afterward or more fruit, it seems to go away. But I'll tell you what, when it wakes you out of a sound sleep, obviously it's painful.
Yeah, no, if you've ever had a Charlie horse, imagine wakening up to that Charlie horse, especially I get them after I do substantial working out in the hamstrings. And I'll put my leg behind me as I'm sitting in a chair, and ooh, I got to stand up quick because it's just going to pull that leg right under the chair. But the leg cramps are caused, as far as we know, main things inadequate blood supply. Again, this lady we were talking about that had the clogged arteries, she would be very prone to cramping. because the blood cannot get in and out, taking your waste products out that your muscles create. A nerve compression would definitely, like at the if you had a bulging disc in the lower back, would give you cramping type sensations. But most people, what they're fighting is what we think is mineral depletion. So too little potassium or calcium or magnesium. Those are probably the three most I try with patients to say, hey, try a little magnesium supplement. Or most people think it's the calcium, but I found magnesium seems to be the better answer. And there is no guarantee that'll work, but a lot of it has to do with hydration. If you're dehydrated, not paying attention to that, I'd say number one thing is, especially if you have these cramps are new and you get them several days in a row, push water like crazy and see if that doesn't just happen to make it go away.
A banana, which is like a great big stick of potassium, seems to help too.
Bananas are a great source. Actually, oranges are a great source of potassium as well. The magnesium, uh, I often will tell somebody just to get the supplement, the 200 or 400 milligram uh, magnesium supplement, and just do that for a week or two, see if things don't clear up. But it gives you a pretty nice test to see if that works. And then I have one more trick that, of course, is not in the medical books. Well, it kind of is. They used to use quinine to treat cramps. Quinine is a cardiac or a heart related medication. So even at 200 or 300 milligrams, which is what we used to prescribe, it's theoretically a threat to somebody with heart arrhythmia. So this is kind of that would be dangerous. But tonic water with quinine in it. In fact, if you're familiar with gin and tonics, you could have your tonic without the gin, and you can even throw a little lime in it and just do an 8-ounce glass of that at night. So it's basically seltzer water with quinine, and it's a very, very low dose. I used this with my mother-in-law who had cramps almost every night for years. And, that's when I think I first gained her confidence as a doctor because that worked out pretty well for her. So it's,
Son-in-law came first, then doctor later, right?
yeah, yeah, it's true. That's true. I had to win her over as a doctor.
It's
So,
8:52. Dr. Jonathan Tripp is in studio with us, and you're listening to Better Health from Tripp Family Medicine on News Radio 1310 KLIX and News Radio 1310.com. Question or comment for the doctor? The number is 736-0300. Restless leg syndrome came about. I never heard of it until I guess it was classified as an ailment, what, some 20, 25 years ago?
yeah, no, it is a lot of people confuse muscle cramps with restless legs, but restless legs is really a struggle for people that have it because they'll be already falling asleep and life is good, and then their legs just they have itchy sensations or burning sensations or just feel like they got to move. And so they'll wiggle their legs around and even get up out of bed and walk around to try to get them to calm down. It's kind of like the rest of the body has checked out and is ready to go to bed, but the legs are saying, we got something else we got to do. In fact, I liken it to at least the old cars that we used to have where it does the knocking and pinging and the idling that happens after you turn it off. That's kind of how the legs feel to these people is, I've turned off the engine, but it won't quit. I can't get it to stop. And so the question is, what causes that? And I have various theories, and the patients give me their experience, and I try to pay a lot of attention. And is it a shortage of oxygen? You just needed to breathe more deeply a few times before you go to bed. I have a lady in our office said when she was pregnant, she got this, and it is pretty common in the third trimester and tends to go away after delivery of the baby. But she said she found if she takes some deep breaths intentionally before going to sleep, that it wouldn't happen. But if she didn't do that, that was how she also cured it, was waking up, breathing deeply. So oxygen supply is one possibility. There's definitely a hereditary component. If you start having this before age 50 outside of pregnancy, it's more likely your parents had it as well. One of the things that we find that helps some people is using medicines that increase a neurotransmitter, or you can call it a hormone in your brain called dopamine. And so we use some medicines that typically are used for increasing dopamine in Parkinson's patients. And that medication will often shut down the whole problem. And yet, I hesitate to tell people that it's a Parkinson's medicine because now they feel like their next phase is to have Parkinson's, which is not there. I don't know that there's any connection there, but the medicine does seem to help. So there are things we can do. Other treatments really to look for that has more to do with exercise. Like we were saying, if you don't exercise, you're more likely to have this. Um, if you're taking narcotics, it's a two-edged sword. Sometimes the narcotics can dull your brain enough that you don't notice it. It doesn't get rid of it. But other times, the fact that you're using narcotics may set you up for having more restless legs.
Some of these, of course, when you say narcotics, some of these things could be prescribed too, actually.
Oh, narcotics, almost all are prescribed. I mean, there are some things that are not. If we talk about heroin or cocaine, those would be narcotics. But we're talking about hydrocodone, oxycodone, morphine, things like that that are used for short-term or long-term pain management. And from our office point of view, we stay far away from that. There are things you can do for restless legs, but again, some of the things that people would like to have are very addictive, and we try to avoid that and look for the other. What can you do physically to make this work better? Can we get a little exercise in? What are we doing on your hydration level? Uh, I'd rather use the medications we talked about that have to do with dopamine because they're not addictive, and then they usually work very effectively. So that's an area that there are some other addictive related medicines that are recommended, but when do you stop? I guess if you're, you know, 98 and you just started having this, I'm not nearly as worried about my addiction problems than if you're 48.
We should point out we only got a little while left here, but a lot of what you've been talking about today seems to come down to just diet and exercise.
Diet, exercise, and loss of weight, I cannot say how much it changes everything in your body for the better. It really is. It sounds too cliche, but the truth is when you lose weight, when you're watching what you eat, when you're eating fresher fruits, vegetables, uh, this really does contribute to your health in every way and how you feel. Your energy level even goes up.
We always like to mention contact information for your office before we wrap up. Got about a 50-second window here.
You bet. Our phone number is 208-933-4400. Our Facebook page is Tripp Family Medicine, and our website is trippfamilymedicine.com. And next week we'll be talking about wellness and wellness programs.
We've got Dr. Jonathan Tripp back with us next week. Hope you can stick around. Another hour of the show coming up. This is Better Health with Tripp Family Medicine. We do this every Wednesday between 8:30 and 9 o'clock on News Radio 1310 KLIX and newsradio1310.com.